what the doctors are thinking. So allow me to welcome our guests joining us for this special conversation. I want to start by welcoming Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. With us also on this broadcast is Dr. Ashok Seth, Chairperson of Fortis Escorts, the Heart Institute. We've got Professor Brahma Mukherjee, Professor of Epidemiology and Chair of Biostatistics at the School of Public Health at the University of Michigan. Giridhar Babu, Professor and Head Life Course Epidemiology at the Public Health Foundation of India. Last but not least, Sangeeta Reddy, Joint Managing Director, Apollo Hospitals. Because not just the doctors, but also how the medical healthcare sector looks at each of these questions. Welcome to all our guests. And I want to put that question first to Dr. Trehan. Dr. Trehan, many watching, especially me, desperate to hit a gym again and really now beginning to wonder when will we be able to go back and start working out. Cumulatively, it seems that 60% of the doctors we spoke to feel that only after 6 months. Why does it need to wait for so long, Dr. Trehan? Welcome.
So, as you can tell from the results of this survey, nobody really knows. This is all guesswork because we really don't know how this COVID is going to work itself through society. We know right now that things are peaking. It will continue through July. How it settles down after that is going to be the key to our future predictions. So the point basically is that gyms are actually quite a sort of a trap for spread of infection. Because of the fact that people are working together, they are exercising and breathing out heavily. How many of them can actually do the gymming with masks? So these things can be worked out. But till the peak is there, I don't think anybody should hazard going to a gym.
Dr. Ashok Seth, what changes 6 months later? My immediate question would be, if a vaccine is going to take about a year, year and a half, maybe two to come, how is it that 50% of the doctors seem to say that, okay, after 6 months it will be safe? What's the difference between going in July as compared to going in January if we still don't have a vaccine out yet?
Absolutely, you're right. The virus is going to be around for a long time. We don't know when it peaks and what is the status in 6 months' time. So let's not do any guesswork. We all know the cautions, we all know the precautions, we all know why gyms are bad. Because you breathe heavily, you touch, there's a lot of close contact, you can't wear masks while gymming. But it's so important to start thinking that exercise can actually be done anywhere. Weights can actually be done anywhere, and that's what you're taught when you travel, that you can still lift anything and still continue those exercises. All you got to do is start thinking now. Transfer your gymming experiences to situations where you can do it alone, do it in a safe environment, and do it all by yourself. And if you can do that, then you're reassured that you'll still stay fit and still actually wait for the right time when things get better, and nobody knows when. 6 months is not a time frame. It could be a year. The virus could be around for 2 years. And I think you'll have to take all the precautions as we go along and take it by the ear.
Sangeeta Reddy, from my perspective, from what I hear from Dr. Trehan and from Dr. Seth, essentially figure out where in your house you can squeeze a mini gym and get started. That's the only way. There's no point in waiting for your main gym to reopen. That could be a long wait for everyone.
That clearly sounds like what all of us are in for right now, because the scenario is unpredictable. It is hugely dependent on the discovery of a vaccine and its availability at scale. But I think there's also another factor, which is when do we peak? How many people in the community develop antibodies and immunity? And how can you configure certain arrangements? Two things remain clear. One is that irrespective of everything else, in the new normal, hand hygiene and cough etiquette is a must. Social distancing and masks will depend on the vaccine. That's the simplistic rule you can apply across the board.
Okay, I want to come now to the second question. Remember, there are 12 questions I'll take you through over the next 40 minutes. The second question, and I'm sure a question which is as relevant for me as it is for many in our audience, when would it be safe to send children to school? So let's put that on our screen next, because this again is a very important question. When can you potentially start reopening schools, start sending children to school? So now about 48% of the doctors we spoke to said in 3 months it may be safe to start sending children back to school. 48% said that you can send them back after 3 months. Let's just go to the next frame. About 27% said that you can send children back in about 6 months. 14% said after a vaccine comes. Then 8% said after 1 month. And 3% said never again. So let's just go back to all our guests, and I'll start this time with Professor Brahma Mukherjee, because she can look at not just what's happening in India but also internationally. Now, it seems to indicate through this survey that doctors feel it may be safe for children to start going back after 3 months. Is it because children aren't contracting this infection in the same way as adults are, and especially older people? What's your sense? Will it actually be safe for schools to open this year? Professor Mukherjee, welcome.
Thank you, Rahul, for having me on the show. And I think this is a really changing narrative that we have seen, that the expert narratives are changing, as well as our personal narratives in terms of how we manage risks is changing as well. So if you look at the data, the rate of testing positive or fatalities are very small in children. But that does not mean that it is safe to let them go back to school without the adequate precautions, because I think they can come back, and India has a household structure where many people are living in the same household. So they can bring back, they can be carriers of the disease to the elderly and the vulnerable living in the same household. In Denmark, for example, when they went back to school, people have been very, very creative. They used the churches to actually take students in a bigger expanse, because churches were not used on the weekdays, and the math teacher was standing on the pulpit giving math lectures. And most of their curriculum, they tried to take kids outside. It's very important for our kids to learn, and if kids do not go back to school, then parents cannot go back to work. So I think that should be a real priority. And in many countries in Europe, they have tried to do this successfully. I saw a little documentary where kids were actually outside in the church cemetery looking at tombstones to learn about numbers. So the more we can actually think about spreading them and using all the measures in terms of hand washing, disinfecting the desks, and have curriculum outside activities, we can bring them gradually back.
Dr. Babu, there's a lot of frustration in my household, for example, with with these online classes. I have a young son, and for him to spend a lot of time on that computer is very, very difficult. He simply doesn't have the patience, and I'm sure this is a running narrative in homes across the country. And therefore, all parents very anxious to know whether there'll be school this year at all. Most of the doctors in the survey suggest that after 3 months, it may be safe to start sending children back to school. Would you agree with that perception?
3 months might be very optimistic timeline, Rahul. The reason is we do not know yet in terms of how the children are getting affected in India. The reason I say this is 1 in 3 children are undernourished, and all the people who have undernutrition will have poor immunity levels. So the kids might be at higher risk when they're exposed to close contact settings within a closed space. That's the first thing we need to be really concerned about. The next thing is they are at higher risk of spreading the infection to the elderly and those who have coexisting illness at the home. So for these 2 reasons, we have to wait for some more time. This is my personal feeling.
Dr. Trehan, will there be school at all in its physical form this year, you think?
I will just tell you one thing, that this virus is so unpredictable and the levels are so unpredictable that we should take the decision at a given point. So say end of July, we will know where we are going. I don't think schools can start before September. I agree with that majority view that at least 3 months. And the new norm is the children have to learn distance learning. And one of the things that was mentioned by our co-panelists about going to school, maybe when the weather is better, you can hold them in open air or in larger classes where you have fewer students. So those are things that have to be worked out. And sanitization and all that and masking, of course, will be a norm for some time. But at the same time, the children, we have to measure how well are they getting educated at home and how it will affect them in the future. But I think 3 months is a given, maybe more than that.
Okay, you're saying 3 months, maybe more, Dr. Seth. What's your sense? Because parents who are watching at this time are getting pretty desperate for their children to start going back to school. Of course, they don't want to compromise health, but they want the children to go back and study in a proper classroom.
Sure. So I'm not going to repeat what others have said because timelines cannot be decided. But one thing is clear, that unlike gymming, which you can actually do at home, online education is only a supplemental education and cannot be the mainstream. There's a lot of growth and development in a child which happens as a result of going out to schooling and onto a face-to-face schooling. So clearly, whatever the time frame be, it'll have to come back in a very different manner of separation, of hand washing etiquettes of children, of even wearing masks. But clearly, face-to-face learning will have to come back, and online will be only a supplement. So this is totally different to gymming, which one can actually even forgo for the next couple of years, because you can gym at home, you can you can run around in a park where there's less people there.
Okay, let's come now to the next question. We're in the middle of the Grand Indian summer. Most people watching, I'm sure, desperate or ideally would like to go on a vacation. And then the question is, when would it be safe to go on a vacation? So when we put this question to the 111 doctors, and remember, nobody really has the perfect answer. There is no perfect answer, but what we're trying to do on the show is give you the sense of what the herd wisdom is. And remember, when you're doing polling, herd wisdom is actually very important because it gives you a broad trend about where things are going. So after 6 months, say 51% of our respondents after a vaccine come is second, 36% of the respondents saying that. After 3 months, say 9% of the respondents. Now with precautions, only 3%. That was my pick actually. I would have liked to go, if it's possible, with some precautions and see if we can, if you're going to be working from home, and now there's so much news anchoring happening from home as well, I thought I was at least toying, not very seriously, but toying with the idea of working from, wherever. Pick any resort that you'd like to be in or holiday home and work from there. But that doesn't seem to be a preferred choice for the medical fraternity. Why is that the case? Let me put this first question to Dr. Ashok Seth. When doctors are asked, when should you go? Only 3% say now with precautions. So you basically want people to stay home. You don't want people to go out. It's not such a bad idea. If I'm going to be working from home, many would argue I'd rather work from home from Kerala, Goa or Himalayas.
Not a bad idea. Himachal Pradesh at the moment has the least amount of COVID, as you know, and there are vast open spaces. There are two aspects to it. Clearly, holiday is not a bad situation, especially if you're going out to areas where there's going to be less COVID and vast open areas. It's actually to do with how you get there and what sort of resort. If it's going to be a congested area, what is it all about? It's all about isolating yourself, and you can isolate yourself into vast surroundings and live by yourselves, or you can isolate yourself or you can have a happy time in a highly congested surroundings. So the holiday, unfortunately, always means going to resorts which are packed, having a great nightlife, having a great fun during that time, but that's not going to happen for quite some time. Those resorts are going to go away. But what's going to come back certainly is that if you can travel safely by your own car to areas which are not very congested, where distancing can be maintained, where proper precautions are taken, where the hotels open up in a very systematic manner to make it safe for you, then those holidays are going to come back. So it's going to be a shift of a holiday, of not the congested fun and frolic, not Ibizas and the stuff like that, but it's just going to be more peaceful places where you're alone and perhaps in the middle of nature.
Sangeeta Reddy, but one of the arguments I heard against going out on a holiday is that if you're in one of the big cities, be it a Chennai, a Bengaluru, a Mumbai, or a Delhi, or Kolkata, or wherever else, you at least have access to high quality healthcare, whether it's the Fortises or the Medantas, you have proper hospitals, you can go to them. Now suddenly you're in the back of beyond, and God forbid something were to go wrong, your access to healthcare is far more limited than it would be if you're in a big city. How do you view the question about when it would be safe to take a holiday?
So I think doctors clearly are saying don't travel if you don't have to, and that's the hypothesis behind pushing back the holidays. I agree with Dr. Seth that if you find the quieter places, you can travel. And in direct response to your question, I think that we need to remember that for a majority of people, the COVID virus gives you a fever, gives a sense of body pain, but is not life-threatening. It also has a certain incubation and a window time, And it's not as if you get the virus today and tomorrow you need a ventilator. So you do have travel time. So I would like to remove some of the fears around the virus. And I'm very sorry to go back for 1 second to your last question on schools reopening. 2 points I really want to add. And one is that many homes don't have, unfettered access to a computer for children. And for a lot of our Indian school children, the midday meal scheme is a mainstay in terms of their nutrition. So I would urge all educationalists to please figure out a methodology, whether it's staggering of schools, start early, reduce the number of children per class. A multitude of methods must be used, but we have to open up schools as soon as we can. It may not be August, but hopefully, definitely by September, we have to find a way to get schools open safely.
Dr. Giridhar Babu, you are absolutely not allowed to take a vacation. But I'd like very much for you to share your thoughts about when you think it's safe for others to start taking vacations.
Yeah, one of the reasons why people take vacation is to have adventure. And I would say staying at home, taking care of your children itself is a big adventure. And also managing your work from home is also an adventure.
People have had enough of this adventure. Most people who are watching you would say over the past 3 months, we've had, if this is your definition of an adventure, sir, we've had enough of this. Thank you.
No, but Rahul, the point here is it's absolutely not safe yet when we don't know how the trends of infection are surging in different parts of the world. Within India also, different states are surging at different points of time. So therefore, to put a blanket statement of going to travel at this point would definitely be very difficult. We'll have to wait for at least 6 months to even figure out where one can safely travel. There are a few countries which are making travel arrangements where both countries have low prevalence of COVID-19. For example, New Zealand and Australia are considering. So those kind of options might be available when there is low prevalence, when the surge has dropped down.
But it's not stopping people in the United States from going out to the beaches of Florida and the other beach resorts, Professor Mukherjee. In India, people are very careful, but where you are, everybody says, yeah, it's holiday time, the sun is out, it's good weather, we're having a nice summer, let's go live it up. And here we've got Dr. Seth, Dr. Trehan, Sangeeta Reddy, everybody advising caution.
So I think in US, all experts are also advising caution. Whether people are going to adopt it or not, that's their individual freedom. But I think that this is, and they are, as you saw, that there is an effect of being out in the beaches and not following masking and social distancing guidelines. And there is a huge spike, and we are into the growth rate same as in March in the United States. So we have to be, so I think the people of India are prudent to use caution. And I think we have to be vigilant and in terms of taking our precautions and avoid non-essential travels. For me personally, I'm dying to go back to India and see my parents, but I am going to try to maintain a semblance of normalcy and choose the right time. And at one point of time, it's a personal management of risk. It may become that my mental health situation without seeing my parents is getting worse than taking the risk of taking an international flight. And at that point, this will become essential for me, and I'll prioritize. So I think, but as a whole community, we cannot all just run around partying and hugging people and taking vacations. That would be really, really detrimental and apocalyptic.
You know, the other very interesting thing, Dr. Trehan, is in India, people are still being careful. When I see the images being beamed out of the United States, usually the typical stereotype would be that Indians are indisciplined, unlikely to follow rules. Here in India, people are being so much more careful than they are in a place like the US.
So, they are paying a huge price for it. It was all bravado in the beginning. Governor after governor said there's no need, you can go out to beaches, and now you see what happened in Florida, what's happening in Texas. I mean, it is foolish to play with this virus. Everybody has the same desire to go take a vacation, but you go no matter where you go, no matter how isolated the place is. If either you're going to live in a log cabin and serve yourself for everything, you may be okay. But whenever you're going to go to a hotel or any place where there's going to be outside help coming in, You never know when it's going to spread. So you saw Bengaluru, I heard a few weeks ago, oh, we are going to be the best city, we are well controlled and everything. Now it moved to Bengaluru, now Tamil Nadu. So this is a unpredictable situation. Sit tight, gauge it every month. I'm not saying you just don't move for the next 6 months or a year, but do not venture out today because it is spreading like crazy. Being a medical practitioner, we hear about it. People who have been saying that we have isolated our whole staff, we are isolated, how did we get it? There are no answers. So please, this is not the time to venture out or show any bravado.
You know, you're saying this is not a time to show bravado, and this is when I want to ask Dr. Seth that there was a perception earlier, and I know that it was shared by some doctors as well, and very seasoned doctors, that there is something about Indian immunity, whether it's the BCG vaccine or just the kind of food we eat, the water we drink, that Indians aren't getting it as bad as was the case in countries like Spain, like France, like the UK and elsewhere. Do you still generally have that view, or do you believe that just because you went in for a lockdown, the cases didn't explode, and now that those lockdowns are getting over, cases are beginning to spiral in a bad way?
Yeah, I think you know, retrospectively, yeah, we didn't have enough conclusive proof about that. We were hopefully and wishful thinking. But still, Rahul, we're having a lot of cases, but we must also remember that we're not supposed to live in fright. We're supposed to live in caution. The number of deaths, luckily, is still a lot lower than most of the Western countries. Whatever the reasons may be, that we certainly see 3% or less deaths. We're seeing lesser people on ventilator, even as of today, as the numbers continue to rise. Let's hope and pray that's the way it stays. So we are still different to the West. We're not surprised about the increase in numbers. That was to happen with unlocking. That was very clear. We still have to be very cautious. And I think all we're saying is, don't live in fear. Live with the precautions. And by the way, you know those things which are happening in the United States, let's not fool ourselves. It's happening in India as well. We're just not seeing them. But if we go around, I've gone to a bank. I was surprised that the teller behind the bank had the mask on. They were actually congregating at work. The unfortunate aspect is that people at work do not believe they'll get it from each other. They think it's going to come from someone outside. And they still sit next to each other without mask on, having food, having everything. And to me, a mask on a chin is of no use. It needs to be up on the nose, and yet people just wear their masks on the chin and move around in congregations. That's where we are wrong, I think, Rahul. I still don't think that people in India understand as much as they pretend that they're understanding.
That's important. I want to come to the next question. Again, each of these questions are straight out of my list, and this question has to do with going to a hairdresser to get a haircut. I desperately need a haircut, as I'm sure most people do. Some have tried the Atmanirbhar style of getting haircuts. It's a bit of a mess. But when would it be safe to go back to a salon? So after 3 months, say 28% of our respondents. After 6 months, say 26% of our respondents. Now with precautions, say 21%. 1 in 5 say now with precautions. After 1 month, say 19%. After a vaccine, say 3%. So let me put that question first to Sangeeta Reddy, because a lot of people would be veering to the idea of going back to a salon with some precautions. Why is it that so many doctors seem to think that it's better to, you know, not go to a salon at all, look like a complete royal mess, but not go back to a salon at all?
So clearly, Rahul, a salon is a place with close contact. Also, one of the other aspects about the virus is that the risk increases with the length of time that you're in contact with the person. So passing by each other, sitting close for a few minutes is different, but in a salon you will spend half an hour and be in close contact. Even if the beautician or the therapist is wearing a mask, you still have multiple surfaces of contact, so the risk is high. And like you, I think all of us have longer hair than we've had in a long time. So, but we're learning to manage. I think there are a lot of home remedies coming up. I think this is one thing that you can forgo for a while.
It's just, yeah, of course, it's very easy to say, forget it, don't do this. But what about the idea, Dr. Trehan, of calling somebody over? Now you've got urban clap and what have you. You just give them a call, they come over, they're supposed to be wearing, I haven't tried it yet, but some of my friends have, and they have a PPE kit, they come with face shields. Would you try something like that?
Yeah, I think, there is one part that underneath all this, there has to be a gradual effort to bring things back to the new norm. And the new norm is taking all the precautions you can. So what are the precautions? If both people wear a double mask for that encounter, maybe the person who's giving the haircut or whatever wears an N95 with a shield and stays at some distance and make it quick. It doesn't have to be an hour or two, maybe 10, 15, 20 minutes, because we have allowed airlines. Don't forget, we debated it for a long time. We have prescribed how you can fly, how the distances can be, and even if somebody in the middle seat is sitting there, we will give them a PPE wrap, just the gown. And so I think that we will have to take some measured risks, because we can't just be frozen forever. But like I said, if a salon has one person coming at a time, or there are two parts to it which are wide apart, and they take all the precautions, I think we can start moving in that direction. So let the young, what did they do in Europe? They recommended that the young should go first, because they are the least vulnerable to having serious consequences. Let the older people, 60 and above, not venture out into these things.
But the difference between Europe and India, sir, is that in India, very often the young come back and live with the old. Whereas in Europe, many of the older people tend to live by themselves.
Yes. So that's not the situation where you want to recommend it. There are small children in your house and elderly in your house, don't do it. I'm saying that if you are in the middle group, so you're talking about from 18, 20 to 45, 50, even then you have a slight danger after taking all these precautions. But they are the ones who have been the frontier of trying to open up things. Now, if you go stupid and go to a pub and start celebrating with 20 people without a mask and boozing, of course that's stupid. But when you talk about, say, a salon, where they have prepared everybody in one way or the other, then you may be able to do it and say, go for a quick haircut or something like that. With your N95 mask, don't talk, just get your haircut done and leave as soon as you can, and let the sanitization be done properly.
In the way that you're describing it, it almost feels like a counter-insurgency operation where you're somewhere in the Kashmir Valley, you're going after some terrorists, you need to be very careful lest you step on any landmine. I'm going to slip into a quick break right now. When I come back, I have 7 more questions to go. So questions like, when is it safe to go back and work in office, not at home? Yes, that still is the case. You have an office, many of you need to go back sometime. When would that be safe? When is it safe to hug someone? When would it be safe to shake hands? When is it safe to go to a religious place? We're getting good feedback for this broadcast. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.